Hi, I'm Billy Giles. I'm an otolaryngologist in the CENTA Medical Group here in Columbia, South Carolina. I've been in practice for over 20 years. After I finished my residency in otolaryngology, I did a pediatric otolaryngology fellowship for 1 year, and then I also did a facial plastics fellowship for an additional year. What I'd like to talk to you about today is something that pertains to both specialties, and that is otoplasty. Otoplasty means to change the shape of your ears. It has become one of my favorite operations. I feel it has more impact on somebody, even more than a rhinoplasty, as far as changing their self-esteem and having a positive impact on them. Children, particularly boys in young age groups in elementary school and junior high and even high school, who have very outstanding ears, prominent ears, have a significantly increased behavior problem than do boys that do not have ears that are sticking out. The way the operation works is that most ears that are too big and are sticking out have one of two problems, or maybe even both problems. One is that the bowl, which is right behind the ear canal, the bowl of the ear is extremely large and it's curved and it props the ear away from the head. The other issue could be that there is no fold in the ear. Right along the edges of the ears there should be a fold called the antihelical fold. If that fold is not present, again you have a very flat ear that sticks straight out from the head. The surgery itself is a 2-hour operation. It can be done on the older children and young adults under local anesthesia with a little sedation. But the younger children, elementary school, junior high school age group, usually need general anesthesia. By putting a fold into the ear, or by tucking the bowl down, the ear becomes much closer to the head, has a dramatic change in their appearance. It's probably my favorite operation to do besides cleft lip and cleft palate, due to the fact that it just changes personalities in a positive way. There's a very high rate of behavior problems in young boys, particularly, that have ears that are sticking out more than average. And in adults, the change in their self-esteem is also very dramatic. It's a fun operation from my standpoint due to the significant impact on their behavior and on their life.